Yes, there is a doctor in the house, Dr. Chris Luke. Great to have you back on the show.
Welcome, Chris.
Today we are talking about anxiety and panic attacks. Brezzy was in the news during the week saying that he gets panic attacks by watching him on TV and singing, talking, chatting. You would not expect that guy. He's as cool as a cucumber. But what actually causes these panic attacks?
Well, I suspect we should describe him as the great example of how to control panic attacks, or a panic disorder, which is when they recur. Panic attacks are actually remarkably common, and about 5% of the population will experience them. And they're basically a fear attack, or a fear of fear attack, with the kind of understandable response, the racing heart, the feeling of sickness, suffocation, perspiration, palpitation, and a sense of being in a dream, a surreal, horrible dream. And basically it's caused by too much adrenaline, or too much adrenaline-like hormones in the circulation.
Yeah. But at some stage, almost all of us experience a once-off panic attack.
Yeah, and basically if you go back in evolutionary terms, you have this thing that we learn about in biology called fight or flight. Now basically if you think about you're being attacked by or threatened by a saber-toothed tiger, the body has to get out of there. So what it does is the heart races up, the blood pressure shoots up, you become incredibly lucid, and you have a heightened sense of awareness, and your heart races. But because you're busy escaping from the tiger, you don't notice that, and it does the business. It gets you out of there. Now, what happens with panic attacks is that there's a false alarm. There's a paper tiger, or an imaginary shadow of a tiger, and you have a false alarm which triggers the fight or flight, but inappropriately. And if you get the panic disorder, which is recurrent, you start getting this completely inappropriately, and it becomes very disabling, very debilitating.
And can you overthink this then, Doc, to make it worse?
You can, absolutely, and you become afraid of the situations, such as a crowded bus or a pub or even open space, because agoraphobia is the famous fear of the open spaces or crowds, and that can be very, very common.
Chris, just to bring us back to actually when you first have or when one has the first panic attack or panic incident, does there have to be an underlying issue that brings this on?
There can be, and there's a couple of very important messages I'd like us to get out this afternoon. One is that if you have a panic attack, the first panic attack must be taken terribly seriously, because it could be an asthma attack, it could be a heart attack, it could be a form of epilepsy. There are very serious possibilities. So you really need to be seen medically. You need to see your doctor or go to the emergency department. If you really feel like, typically as a male, that you're dying of a heart attack, or as a female that you're suffocating. They would be the kind of classic distinctions. You can wake up in the night nocturnally with nocturnal panic attacks and feel like you're suffocating, but that can be, in the elderly, a sign of heart failure, for example. So you really need to have your first panic attack investigated thoroughly.
Let's take a look at the classic symptoms of panic attack. We do have a graphic here. These would be the type of feelings you would have: palpitations, sweating, trembling, shortness of breath, as you said there, and pains in the chest. Would that be for everybody, or would they just have one or two of those?
Well, there's probably about 20 different symptoms that you can get, but the bottom line, you can describe it as a sort of palpitation, perspiration and suffocation. Those are kind of three overwhelming sensations. That I'm claustrophobic, I'm choking here. And the key trigger to that is this question that you ask yourself: oh my God, am I losing control of myself here? And then it's the fear of actually about to lose control that triggers all this panicky response.
Doc, loads of people getting in contact with us here. We have a text in: my daughter is 13 years of age and has panic attacks after school every day, in school every day in secondary school. Any advice? That's 13 years of age getting panic attacks in secondary school.
Now, first of all, it's vital that they establish contact with the GP. And that they have a point person medically who knows the daughter, maybe knows them since they were a small child. Very important. A sympathetic, reassuring, familiar face. They need to have things like asthma or other things, as I say, like it's occasionally unusual types of epilepsy, kind of partial epilepsy, or other conditions, thyroid conditions and so on and so forth, excluded. Classic irritable bowel, for example, or reflux can cause these things like chest pain or shortness of breath that make, again, trigger a panic attack.
Do you not think that's very young, though?
It's very young. Most panic attacks would probably begin between the ages of 15 and 19, and people can go on then to have a lifelong panic disorder. But adolescents, we have to be particularly careful, because they can start having thoughts of self-harm. And I don't want to go delve any further into that, but it's very important that they do make contact with a doctor, and possibly even get psychological help, because there may also be underlying problems of bullying and other sort of traumas in the background that are underlying.
As a child, when I was in school and when I was a teenager, I didn't like reading aloud and stuff, and I actually felt, now we never I didn't even hear of panic attacks
Yeah.
back in those days, but I would have a feeling of being really nervous, sweaty palms, all that
Correct.
if I was asked to do something in school. And I suppose that was maybe a slight form of a panic or an anxiety maybe.
Absolutely. And what happens with panic disorder in youngsters is that the school grades start to fail. You get truancy, you get abdominal pain, you get lots of sickness, and so on and so forth. So
needs
it's
to be
important to
addressed.
exactly to investigate.
Yeah, this person 13 years of age and it's happening every day in secondary
It's
school.
too much,
so yeah,
really,
it's
isn't
very,
it?
very young.
Another one here on the other side of the scale, a 75-year-old recently had a serious illness. I've started having panic attacks when I try to cross the road, so I take the car the short distance to the local shop. Could this be age-related?
Absolutely. Now, a first onset of a panic disorder at that age would be pretty unusual because normally you are thinking in terms of long-standing anxiety or phobic or obsessive disorders, which become manifest really in people's teens, as we've heard there. So it's important that diseases of the heart and the lung, which do make people feel like they're suffocating as well, or give them chest pain like angina, they really need to be excluded along with thyroid hormone problems and excess or a deficit and so on and so forth. But again, the problem with panic is the notion of avoidance. So this person typically is seeking to avoid the trigger situation.
And is that a good thing or a bad
no,
thing?
that's a logical thing, but a bad thing. And what you really need to be doing is to be thinking through the irrationality of the fact that you're afraid of going into your familiar pub, your regular morning bus, or crossing the road. So you have to think through that. You have to perhaps discuss it in terms of what's called cognitive behavior therapy, which is the talking therapy with your doctor or psychotherapist. And interestingly, there are increasingly online possibilities of having one-on-one with your computer and an online application for talk therapy.
Is anxiety and panic attacks, are they related to depression?
They can be. So panic, it's entirely reasonable, and if you think about it, to panic if you are struggling with illness. Panicking about your future, panicking about what will happen to your family, panicking about paying the mortgage, as well as the other things of the normal fears. So panic can overlap or be a secondary feature in depression, in anxiety, and lots of other illnesses.
Anonymous text here. I've woken up in the middle of the night several times, unable to breathe and feeling as if I was suffocating. My doctor says that it is a panic attack. It was very frightening. What causes this, and what can I do to prevent it?
Now that's nocturnal panic attacks, and they occur in about 2/3 of people who have the daytime panic disorder. Panic disorder is when you keep getting them. Now, if you are having panic attacks regularly, you have to treat them as panic attacks rather than physical or medical illness. That's the number one thing. Stop worrying that they're medical or physical. They're not. They are a fear of fear. So you have to talk through your fears. You have to learn to control your breathing. Breathing is fundamental. Now, for example, you often hear about paper bags. Now, the two simple messages. Don't reach for a paper bag on the first occasion. But if you have a diagnosis made of recurrent panic attack, you can use a paper bag. Basically, you breathe in and out to the paper bag. That increases the carbon dioxide levels in your bloodstream and reduces the horrible tingling around the face and the hands that can come by having too rapid a rate of respiration, which lowers your carbon dioxide.
What is the pace of breathing that one should breathe at while the bag is to their mouth?
This is the bottom line takeaway message. Take a deep breath in through your nose.
Okay.
4 seconds.
Hold
and then
it.
breathe out as if you're breathing through a straw.
Count to
6
10.
seconds.
Yeah.
Okay, so
the panic
in.
attack typically takes 10 minutes to climax. The breathing should take 10 seconds. And if you get into that habit of breathing like that regularly and
Tell
systematically,
us that again.
in for 4 seconds through your nose and out slowly as if you're breathing through a straw for 6 seconds.
blowing it out.
You'll feel your whole body just
Your whole body
slowing down a
relaxing.
small
Your
bit,
muscles will
relaxing a
relax
small bit as
because
well.
it's affecting the carbon dioxide levels and it's giving you control. Because the whole point is you have a sense you're losing control, but the one thing you can do is you can control the rate of breathing, and the effects of the oxygen and carbon dioxide in the bloodstream, which is physiological, will be beneficial.
We do have a graphic here, I think, on some of these issues, how to control them, as you're saying. So you're saying the breathing there,
Breathing
Chris?
is probably the most important, because I remember reading a show called Charity Eurostar about 100,000 years ago, as you say, Maura, and what you have is what we were told how to calm the nerves.
Yes.
And that's the same thing as anxiety.
Yeah.
So we have your hand in front of you and to blow out for 10 and stuff like that.
And breathing is the heart of yoga, meditation, oriental contemplation, all these things. Breathing is at the heart of changing your mental state.
I suppose breathing, with any of us, and even I suppose what we do here in live shows and
You're
different
learning
things,
to
if you
breathe.
calm yourself
Exactly.
down, you're calming the body and you're
yeah.
calming the heart, you're getting everything just to pace. And that's the basis. And we saw a little thing there, say exercise, and I guess what you're saying is
breathing
yoga
is the
and stuff.
first aid. what to do immediately. But in general, you need to avoid stimulants like caffeine and alcohol and other things like cocaine and other medications that might cause it. You need to get an exercise regime. For example, I'm a great enthusiastic fan of the new Couch to 5K app. You know, you can get those apps on your phone, and there's a nice lady on the app who will take you through the walking, running, jogging regime, which allows you to get off the couch and run 5K in about 9 weeks. That's a brilliant exercise regime.
And it's done slowly, and you're not forcing your heart
Sleep
or
is
your
very
organs.
important. Good sleep hygiene. You know, the whole business of not having too much caffeine or food or stimulation.
It's all linked in together.
It's all linked to lifestyle and too much stress.
I know a few people who've had panic attacks, and I know one particular person that was immediately put on Valium and antidepressants afterwards. That doesn't seem like the right route.
We had a long chat some weeks ago about the dangers of the Valium type drugs. Valium is God's gift to emergency medicine. It's brilliant in the emergency department, but for my money, it should rarely be prescribed for anxiety or panic disorders because of its addictive properties. So talk therapy is the best thing, exercise, sleep, breathing and so forth. And if they fail, then you may benefit from a short course of antidepressant medication that can be very effective.
Okay, we have the aware.ie, of course. It helps you if you are suffering from anxiety. That is a very good organisation to go to, and lots of information on their helpline as well.
There's lots of help out there.
Okay, Chris, thank you so much.
Thank you,
it is a very, very big issue, and of course any of us can get a panic attack at any time, but those tips were really good.